Yes, a pleasant good day, people. And this is Rizza Hennessii, and once again, um, we are here and we have a discussion tonight. Is phlebotomy. So, for all the future nurses, brothers and sisters that are going to be doing phlebotomy, this might help you somewhat in your lesson. I know that this is where all phlebotomy start from, the basics. So, listen to me. We're going to start by the definition of phlebotomy. Alright, phlebotomy is a process of drawing blood from a human or animal vein. So that's phlebotomy. So it's a process of drawing blood. And what is this blood drawn for? For testing. So we take samples of blood for testing. That is phlebotomy. So, people, you have many ways to draw blood from the vein, and you have practices that are modern, and you have practices from even the 15th century, which that was painful, but that was how it was used to done before. Now, you understand me? So let's start from the history of phlebotomy. Okay, phlebotomy started basically in the 15th century, where they used to use certain objects or tools, I should say, to actually hit the vein to pierce it. So we could basically go on to one now, which is the lancet. The lancet was like a blade on a spring, which had a trigger and a cock, where after when the trigger was squeezed, the cock released, and then the spring blade would release a knife onto the vein, hitting the vein, where it actually causes piercing. But these practices were you lost a lot of blood here, more than modern days. But we soon go to that and show you how modern day phlebotomy improve to pass phlebotomy. So what happened is the use of the lancet system was a very painful method, but it actually worked for them back in the days, but it was not that accurate, because modern days phlebotomy is more accurate than past phlebotomy. So that now they used to use and to drain blood into shallow bowls, and also film glasses. And all the blood used to go up in these film glasses. Sometimes the air was heated and it rushed up. Otherwise, you had the Fleming stick, which was basically almost the same thing. The only thing, it was not a trigger. It was the Fleming stick that hit the blade and caused the blade to pierce this, the vein. So those were some of the methods. You have another method which was more merciful. It might sound a little more dangerous, but it was more merciful than the lancet and the Fleming stick, which was a scarificator. This was a tool with 12 razor blades, and when it spun, it actually scarred the surface of the skin, allowing blood to be secreted. So they would rest this where the veins are, so it actually scars the skin, actually cutting into the vein, and that's how they would do it. So, people, back then it was very tedious. People had that as merciful. That one, the scarificator as merciful. Even when they use a scarificator, you have a time where they use leeches. So let's not forget that leeches was a next thing also in past phlebotomy, where they would cover someone in leeches, and then after that the leeches would pierce the body. You understand me? So that method was also a next painful method. So phlebotomy grew. It grew from the 15th to the 19th century. It grew. it changed. You understand me? Things start to get more accurate, more precise. Yeah, remember that in the 1902, that was when even Carl Steiner, um, um, he first, he first found the first blood group. Yeah, in 1902. So a lot of work has been done since that time, and now modern day phlebotomy is 100% accurate. Yes, we have easier methods. The most commonly used method is the hypodermic needle, depending on what type of test you're running. But the hypodermic needle is it's good, but like for a phlebotomist running a lot of tests on someone, I would not advise that. I always think about the patient, not only about the job. I think about what the patient has to go through and how many times you'd have to stick the patient. So I think it's better to use a multi-sample needle than to use the hypodermic needle, because definitely that is going to be sticking the person. If they have to run 5 tests on the person, you're going to be sticking the person 5 times. But if I use a multi-sample, I won't have to do that. All I have to simply do is change my vacuum tubes. Yeah, so people, modern day phlebotomy has proven to increase a lot majorly, and it's more human friendly and even animal friendly, because remember, phlebotomy is not just done on humans, it's also done on animals. So phlebotomy, we would say that since then it grew, and you had a lot of new forms way of doing things. And it's not when you pierce the skin, you actually, if you even lose a little blood around the tip of the needle, it won't be as much as the past phlebotomy. Yeah, it won't be as much. You understand me? So it has grown where you actually only take enough blood needed for testing. You understand me? You don't take too much. But remember, back in the days, they used to say that if they ever drain blood from the body, it can actually cure a person from a sickness. And but more people gain more knowledge now and realize that things can be done much better. And even every day in doing phlebotomy, we know that sometimes there's going to be a time when even a phlebotomist already in the work field probably has to go to a higher level of training, because something new might come up where we have to go workshops and learn. So each day you can learn something new, because we always want to get what's more best for the patient, because it's the patient that matters. You understand me? You have to take the life of the patient into consideration. You have to take how the patient feels. You understand me? And the next thing one with phlebotomy is not just about sticking people with needles or drawing blood when time donations and then somebody, it's not just about doing that. It's about checking on your patient. So after you do all these procedures, you have to ensure that the patient is properly vitalized, because usually before these certain things are done, the patient also goes through a fasting process in order to ensure that the blood has everything at normal quantities that is in it. You understand me? So basically, people, that was just a little brief preview on what is phlebotomy, and preview on the past phlebotomy methods, and to how it has increased today in the modern days. So that was just a little comparison to show certain things that is much more human friendly. It's much more effective, and what I call it now, it's much more effective, and it gives you 100% accuracy. Because back in the days, a lot of blood transfusion and things used to go on. Nowadays, that tends to be on a lesser scale than than back then, because now we do things completely where as you deal with a patient, you ensure that the patient name, the doc, that is your name, either the nurse, the doctor, which performed the phlebotomy on the person, so it should be there, and the date when this was taken. So you have to ensure that the name of the patient is on the test tube, the vacuum tube. You have to ensure that your name is on it, the doc or the nurse that did the phlebotomy. You have to ensure that the date is on it, and you ensure that you put these in a bag, put them in the biohazard bag, and get them to the lab and put them in the appropriate place so they can be tested when at the appropriate time, I should say. So people, modern day phlebotomy has increased. We have less blood transfusion. We have more accurate diagnosing of diseases, which is good. So we can actually know, we actually study the blood more, and we know a lot more about the human body. And each year people learn. So as I tell you, a phlebotomist might be in the work for a long time, but as something come up new, we nurses have to go and do a workshop on it. So people, that was just a little brief discussion. I hope that you have learned something from what I say and I have said, and sorry about the English sometimes. And otherwise from that, we just want you to have a nice day, and gonna tune in for more. So we are gonna have this thing regular now where we discuss phlebotomy and its procedures. Okay then.